Amid growing concerns over widespread starvation in Gaza, more than 100 organizations are calling for an end to what they see as Israel's weaponization of aid. Many humanitarian groups, including Medecins Sans Frontieres or Doctors Without Borders, say they are increasingly not authorized to deliver aid unless they comply with the new, stricter Israeli regulations. Well, joining us in the studio is Dr. Maria Guevara, the International Medical Secretary at MSF. Doctor, tell us firstly more about what's happening on the ground in Gaza, especially with the increasing challenges to deliver aid.
So I think, as many have heard us speak on these before, I mean, it's only getting worse since the beginning. MSF has been there for quite many decades already, and what we've seen in since October 2023 is just a worsening of situation. Just in since March, or at least since May, where the escalation of violence and trauma-related victims that we're seeing in our hospitals or facilities is gone from 2,000, and in July it's gone up to 3,700. Just in this last 6 days, it's already hitting 900. The aid that we speak around, and we've just published a report on the Gaza humanitarian fund support, is a weaponization of aid. Because what we've seen in just the 7 weeks since it's deployed is at least 71 children already as victims. 41 of them were around the Gaza the distribution sites. And when you see an 8-year-old kid shot at the chest, this is not by hazard. So these are the things that we're seeing, on top of which are increasing malnutrition cases, as you've reported. And when adults are starting to die, you know you're hitting famine levels. And yet, the aid's not coming in. When you have 500 trucks that used to come daily into the Gaza region, which is a trickle today, you're bound to have increasing mortality, plus the increasing violence and attacks on those who are working and trying to save their own people, but people who are humanitarian actors like us.
Now, beyond Gaza, there's also the U.S. is pulling out funding in most foreign assistance programming. Yes. How is this affecting people that are caught in between all these conflict zones, these disaster zones?
I think we have to remember that the weight of that funding that U.S. was providing to the humanitarian, but also global health. I think there is this huge domino effect of now not able to get that aid. So for global health, for example, that represented at least 70% of the supports in many of the countries. So there was a study that was reviewed by the Center of Global Development that 26 of the low middle income countries are most affected by this, and at least 23 of those countries like Afghanistan or South Sudan or Sudan, Somalia, DRC or Democratic Republic of Congo are areas where we work, and those are so significantly hit by these cuts. And when those cuts are also implies human resources and supplies, so organizations such as WHO or the UN system have had to relook at and cut not only their budget, but staffing, which means things are not done. Surveillance are not done. Running the supplies themselves are not getting to the areas that they need to be.
And how is that affecting working for MSF? Because you don't get the U.S. government funding, yes, but some of your partner agency, they do. And yes, how does that affect your work when their lifeline is cut overnight?
So indirectly, it cuts us, because even if we don't get that support, we are also partners. So it will cut us on the pressures that, are we able to fill that gap? It will cut us on more patients then will come to us. The referral systems that we were depending on for those are there. And the supplies, even if we are very much active on vaccination campaigns, such as Gavi's and others, who are the ones that enable bringing this the supplies in, or even Global Fund or even WFP for nutrition, when you don't have the supplies, you can't actually work. So a lot of pressure has come on us in a very indirect way, where we have then to reprioritize different programs across the world when there's so many needs.
Now, which areas would you say are bearing these consequences most acutely?
So it's the humanitarian area. So if you look at that study I had reported on earlier, Afghanistan has been quite dependent on U.S. funding and overseas aid. DRC, for example, is dependent on that, or Democratic Republic of Congo, 70% of that. When today, if my teams were to tell me what's happening in Congo, for example, you have in one region conflict and increased fighting, measles, cholera outbreaks, and there, of course, you have hemorrhagic fevers on top of that. They're still reeling from mpox outbreaks and malnutrition. So you compound all this. These are where you're actually seeing it. So humanitarian hotspots becoming even more vulnerable today.
So how do you see this widening vacuum when, after the US has pulled out the aid funds, how do you see this getting worse? A breakdown of global humanitarian support?
Yeah, it's a breakdown of our collective solidarity as humans. And I think we can only call out for more humanity and more solidarity and leadership. There's a leadership vacuum of how do you bring this forward as a community of the world. And hopefully we look at other sources and other leaders in the world to try to step up and fill that gap.
And who do you think should step up and fill that gap?
Singapore? Others, I mean, collectively. And I think we need to continue to remind the people, hopefully, can remind their governments that a collective security starts with individual security and ensuring all of us are safe and secure.
Now, if you had an opportunity to speak to a US lawmaker, what would you say to them?
Do the right thing. History will tell itself.
Oh, thank you very much,
Very.
Dr. We've been speaking to Dr. Maria Guevara, the MSF International Medical Secretary.